How to read an ECG. Presented by Ganesh Sir. SSNMEC. Shivajinagar, Bangalore. An electrocardiogram, ECG, is a test that measures the electrical activity of the heart. It is a simple, painless test that can be used to diagnose a variety of heart conditions, including arrhythmias, heart attacks, and heart failure. Anatomy of an ECG. An ECG tracing is made up of a series of waves, each of which represents a different part of the heart's electrical cycle. The main waves are P wave, PR interval, QRS complex, ST segment, T wave. P wave. The P wave represents the depolarization, activation of the atria. It shows atrial depolarization initiates atrial contraction. Conduction of electrical impulse across atria from right to left and downward. The P wave is the first wave on an electrocardiogram, ECG. It represents the depolarization of the atria, which are the two upper chambers of the heart. Depolarization is the process by which the heart muscle cells become electrically excited. When the atria are depolarized, they contract and pump blood to the ventricles. The P wave is typically upright in most leads on an ECG. However, it may be inverted in some leads, such as AVR. The P wave should be present and precede each QRS complex. Absent or abnormal P waves can be a sign of a heart problem, such as atrial fibrillation. Cause of abnormal P waves. 1. Atrial fibrillation. 2. Atrial flutter. 3. Premature atrial contractions, PAC. 4. Atrial enlargement. 5. Electrolyte imbalances. 6. Medications, such as digoxin and verapamil. P wave provides us heart rate. The heart rate can be calculated by counting the number of P waves in a 10-second strip and multiplying by 6. Rhythm. The rhythm of the heart is the pattern of the P waves. It can be regular or irregular. Atrial enlargement. Atrial enlargement can cause the P wave to be widened and taller. Electrolyte imbalances. Electrolyte imbalances can cause the P wave to be abnormal. For example, hyperkalemia, high potassium levels in the blood, can cause a peaked P wave. Medication side effects. Some medications, such as digoxin and verapamil, can cause abnormal P waves. PR interval. The PR interval is the time it takes for the electrical impulse to travel from the atria to the ventricles. The PR interval is the time from the beginning of the P wave to the beginning of the QRS complex on an electrocardiogram, ECG. It represents the time it takes for the electrical impulse from the sinoatrial node, SA node, to travel through the atria and atrioventricular node, AV node, to the ventricles. The normal PR interval is 0.12 to 0.20 seconds. A prolonged PR interval, more than 0.20 seconds, can be a sign of a heart problem, such as first-degree heart block. A shortened PR interval, less than 0.12 seconds, can be a sign of pre-excitation syndromes, such as Wolff-Parkinson-White syndrome. Prolonged PR interval cause. 1. First-degree heart block. 2. Atrial fibrillation. 3. Atrial flutter. 4. Myocarditis, inflammation of the heart muscle. 5. Cardiomyopathy, enlarged heart muscle. 6. Lyme disease. 7. Hypothyroidism. 8. Hyperkalemia, high potassium levels in the blood. 9. Medications, such as digoxin and beta blockers. Here are some of the things that can cause a shortened PR interval. 1. Wolff-Parkinson-White syndrome. 2. Lown-Ganong-Levine syndrome. 3. Atrioventricular reentrant tachycardia. 4. Junctional rhythm. 5. Medications, such as digitalis and verapamil. QRS complex. The QRS complex represents the depolarization of the ventricles. The QRS complex is an important part of the ECG because it provides information about the electrical activity of the ventricles. This information can be used to diagnose and monitor a variety of heart conditions, including 1. Heart rhythm disturbances, arrhythmias. 2. Heart attacks. 3. Heart failure. 4. Cardiomyopathy, enlarged heart muscle. 5. Congenital heart defects. 6. Electrolyte imbalances. 7. Medication side effects. ST segment. The ST segment is the time between the end of the QRS complex and the beginning of the T wave. It shows ventricular depolarization and contraction. Tricuspid and mitral valves close. Pulmonic and aortic valves open. Ventricles pump blood forward, systolic. The ST segment is the portion of an electrocardiogram, ECG, that occurs between the QRS complex and the T wave. It represents the period of time when the ventricles are depolarized and repolarization is beginning. Abnormal ST segment can be a sign of a heart problem, such as a heart attack, heart failure, or cardiomyopathy. It includes 1. Heart attack. 2. Heart failure. 3. Cardiomyopathy. 4. Pericarditis, inflammation of the lining around the heart. 5. Myocarditis, inflammation of the heart muscle. 6. Pulmonary embolism, blood clot in the lung. 7. Electrolyte imbalances. 8. Medication side effects. An abnormal ST segment can be either elevated or depressed. ST elevation. ST elevation is a sign that the ventricles are not receiving enough blood. It is a common finding in a heart attack. ST depression. ST depression is a sign that the ventricles are not getting enough oxygen. It can be a sign of a heart attack, heart failure, or cardiomyopathy. T waves. The T waves should be upright in most leads. If the T waves are inverted, it may indicate a problem with the ventricles. The T wave is typically upright in most leads on an ECG. However, it may be inverted in some leads, such as AVR. Inverted T waves indicates 1. Heart attack. 2. Heart failure. 3. Cardiomyopathy. 4. Pericarditis, inflammation of the lining around the heart. 5. Myocarditis, inflammation of the heart muscle. 6. Pulmonary embolism, blood clot in the lung. 7. Electrolyte imbalances. 8. Medication side effects. Thank you.